Anatomy is one of medical lessons which has exhaustive material and difficult to be learned. Become a part of anatomy and embryology laboratory assistant isn't an easy thing. Sometimes I should teach our junior in early morning when everybody is still slumber, and then we'd stand with sharp formalin odor and still inhale it even though it makes me hard to breathe. And I also must teach them until late at night even though I have some examination the next day. And then why do I still choose this path? Because I hope that what I've been done can help them to understand this field of science and make them able to help more people in the future. Lembaga Kesehatan Mahasiswa Islam and Red Crescent Indonesia. It is two medical assistant teams that I've been joined since my first year in university, taking care of clinic every 1 until 2 weeks, and also helping course with anamnesis and physical examination. Sometimes we also hold some events, something like social services, such as free medication, circumcision, and minor surgery. By joining these activities, I hope I can increase my sensitivity to others and also my skill. And I wish I can minimize medical errors to the patient when I become a doctor in the future. Educate Quran to the children about 4 until 10 years old in TPA near my university. I also teach them about Arabic language and anything about Islam. I just hope that they can become nation's successor generation who understand Islam entirely. I've been joining Sentra Kegiatan Islam since my first year in university. After 2 years becoming a maintaining division, now I am CR staff. Persuade people to do kindness and prevent them from the wrong are my visions and intentions that I've always remembered as long as I work here. ASEAN Medical Students Association, or AMSA, is an organization that focuses on skills and knowledge of its members. This year, I'm a staff of Community Outreach Division. We hold several events such as a free serum glucose examination in Car-Free Day to celebrate World Diabetics Day. From this organization, I know that when we educate people or inform someone else, we just hope that we can help them to be aware in maintaining their health. Bismillah Production, a social community where I am one of its pioneers. Starting from richness of lecture material until finally chose to make summary book for our juniors. 4 persons then became 26 persons. Summary book continue with making weekly social project and also 1,000 followers on our official account. Distributing many breakfasts for janitors, gathering donation for Palestine and Rohingya, planting small trees, giving some mukena to mosques, and also celebrating International Women's Day. A community which reminds me the importance of sharing kindness to people around us. A group who forced me to always run and innovate along the improvement of the age. And a group who become my family whenever I need them. Those are all activities that I do. Hello, let me introduce myself. My name is BAKTINUSA Al-Mubarakah, but you can call me Marwa. I will let you know myself more. I was born in Tegal, north coast of Central Java, 21 years ago. I'm the last child in our family. I've been wandered since I was in junior high school until now, and that makes me become someone independent. Since I was young, I had embedded a few to always have big dreams and desires. I want to build a non-government organization which focuses to increase health quality in rural areas. I also want to become a pediatric surgeon where there is only a few of them in Indonesia. Not only that, but also I want to become the Minister of Health who improves health quality of Indonesian to become better in all regions, not only in Java. Talking about the predominance of Indonesian nation. Indonesia is a country with more than 2,050 million people, and it places Indonesia at the 4th rank of country with the biggest population. This can be a boomerang or an advantage that can be optimized. Indonesia also predicted to experience demographic bonus in 2030 until 2045. This momentum can accelerate the development of our country. With BAKTINUSA, I want to prepare and optimize this momentum well. How? Increasing people's health using large number of humans. Students, especially college students and community health center cadres, are distributors who give information and knowledge about how to prevent illness and maintain physical and mental health. The distribution of information from them to the society directly is easier to be accepted, hopefully. Cadre or student who handle one small district can concentrate to improve health condition of people there, and it can reduce illness and disease, especially endemic disease around those areas. The information also distributed by using some videos, posters, and some more interesting things in social media. I'm only an ordinary college student who have many dreams. Nevertheless, all of my activities and desires are always based on two advices that I've always remembered. My father's advice when I was really young, he said, "Didn't never force you to become anyone, but please become someone whose benefit can be perceived by people around you." And the other advice from my senior, he said, "Don't forget to return everything that you ever received from this nation by improving your country." Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.